Hi, I'm Andy Haggard from the Central Ohio Area Agency on Aging. Welcome to our series, Medicare for Beginners. In this segment, we will be talking about the differences between Medicare and Medicaid. It's easy to become confused about the differences between Medicare and Medicaid, especially when the two programs have names that sound so much alike. Many times people will unintentionally use these terms interchangeably. For example, they say they have or are interested in one, but actually have or are interested in the other. This has the potential to be harmful at times, such as when a provider is told an individual has Medicaid. They may try to bill Medicaid, but the person actually has Medicare. In this segment, we will look at some very important ways in which these two programs are different. What is Medicare? Medicare is a federal government health insurance program. It provides coverage to persons who are age 65 and older, younger persons who may be receiving Social Security disability benefits, or persons who have end-stage renal disease requiring dialysis or a transplant. Medicare recipients must be a U.S. citizen or an individual lawfully admitted for permanent residence who has resided in the United States continuously during the 5 years preceding the month of the application for Medicare. Medicare works the same way across the country. This means that no matter where you are in the United States, the coverage and benefits under Medicare are the same. The exception is a Medicare Managed Care Plan. Eligibility for Medicare is generally based on turning age 65, although some disabled individuals under the age of 65 may also have Medicare. Individuals deemed to be disabled by the Social Security Administration can receive disability income. If they receive disability income for 24 consecutive months, they can receive Medicare at any age. Enroll in Medicare during the 3 months before your 65th birthday, the month of your birthday, and 3 months after. Contact Social Security to enroll in Medicare. Applications may be filed online at Social Security's website, by making an appointment at Social Security's toll-free number, or by visiting a Social Security office. If you elected to receive Social Security or railroad retirement benefits before age 65, enrollment into Medicare will be automatic. So what is Medicaid? Medicaid is a federal-state program that is typically for lower-income individuals of any age and can be administered very differently from state to state. The federal government mandates that Medicaid cover certain things, but states can choose to cover additional benefits, and that can vary from state to state. States can also have varying income guidelines for eligibility. In Ohio, eligibility enrollment for Medicaid is handled by the Ohio Department of Job and Family Services. In Ohio, call the Ohio Medicaid hotline at 1-800-324-8680 for information and assistance on applying. Individuals can apply at the local Job and Family Services office or online at www.benefits.ohio.gov. Medicare was never intended to cover any type of long-term care services. This could include things such as nursing home stays or in-home care. The exception would be in a short-term skilled stay. To learn more about Medicare, we invite you to attend one of our free Medicare for Beginners workshops held monthly at COAAA. Look for other segments in this series where we will discuss the other parts of the Medicare program. There are also resources on our website, www.coaaa.org.
The Central Ohio Area Agency on Aging supports people as they navigate the experience of aging or disability. We connect people with services that help keep them safe and healthy at home, such as homemaking assistance, transportation, home-delivered meals, and personal care. We offer education and resources to caregivers, professionals, and the public, and advocate for programs and policies that benefit older adults and individuals with disabilities.